Good evening, everyone. I'm Keishel Adderley, and welcome to the Bahamas Tonight, the National Report. Thanks so much for joining us. Well, topping news tonight, health officials are looking to expand testing this week to get a truer picture of COVID-19 infections in the Bahamas. Prime Minister, the Most Honorable Dr. Hubert Minnis, forecast the plan in his national address last evening, and Health Minister Dr. Dwayne Sands said today they'll be zeroing in on key groups. 600 COVID-19 tests have been administered in the Bahamas, but health officials say getting a clearer picture of the mortality rate is key in their data gathering, and that's why more testing is necessary.
We have made a conscious decision that we are going to increase the number of tests done starting this week. The whole idea is that we would like to get a representative sampling of the COVID-19 positivity throughout the Commonwealth of the Bahamas. And there's no doubt that the more extensively you test with reliable, valid means of testing, the better understanding you have of the outbreak.
For example, if there were 5 deaths out of 10 cases, that would account for a 50% mortality rate. The same 5 deaths out of 20 cases would reduce the mortality rate to 25%. Prime Minister, the Most Honorable Dr. Hubert Minnis, announced an extension of testing in his national address Monday. Dr. Sands says high-risk groups are being targeted first.
We want to test the high-risk populations in nursing homes, in the prison, as a general rule of thumb. Then we want to test healthcare workers to determine, how many of them have been impacted. Then we can target other specific populations.
But aside from these groups, officials also want to increase testing of the general population, providing answers on the personal and national levels.
That's starting off with molecular testing in the first instance, and then ultimately moving, once we have valid, reliable antibody tests, to do antibody tests. And that would give us a real understanding of how many people are currently infected, how many people were previously infected, how many people are potentially immune.
And that, says Dr. Sands, will guide the sensitive road back to normalcy.
Well, we have to look forward to a day when the lockdowns can stop, when we can gradually resuscitate our economy, when people can get back to work to take care of their families, to take care of their children, to take care of themselves, without putting their lives in jeopardy. And so this is not a passive exercise. This is something that as a government, we are discussing and determining what is the safest, most effective strategy to keep Bahamians safe, but at the same time to understand that Bahamians have to survive.